Great. Thank you, everyone, for being here today. And thank you, Dr. Bettinelli, for that introduction. Gun violence has skyrocketed across our country over the last year, as if it weren't already bad enough. As a trauma surgeon, that's an especially distressing statistic. I have colleagues across the country who are pulling more and more bullets out of patients day in and day out. I think there's no question to us in the healthcare field that this is our country's chief public health issue. I'm honored to be moderating this panel today on streamlining healthcare solutions so that we can talk a little bit about how healthcare systems and hospitals can come together around this issue. As Dr. Bettinelli already mentioned, I'm joined by 3 thought leaders in this space, so thank you for joining us. And the first topic I really want to kind of hit on is something that touches on the theme of this forum, which is gun violence in communities of color. I'd like to start there, and then we can come back to the public health issue. So the first question I want to pose is, how can health systems really make a difference when it comes to supporting communities of color and those who are disproportionately affected by gun violence? And Lloyd, if you can start first.
Yeah, I think that number one is that we have to look at, in almost a diagnostical way, the complexity of not only just violence, but particularly gun violence. And what I mean, we have to get behind the root causes. When I think about what we see, and we see in our urban areas, but we also see gun violence in many other profiles of the communities that we serve, we find that it's the solutions, and the issue is one of often of a lack of financial resources, a lack of parental guidance in many of the communities that we serve, unemployment, and often youth in particular, but members of the community see violence as a, if you will, pathway to acquiring resources or being able to do things. Obviously, gang violence. So we try to get to the root causes and then figure out what can we do with other members of the community. Because as you said in your opening, we see gun violence and the results of it almost instantly at our EDs and our ERs.
Great, thank you. Peter.
You know, I agree with Lloyd that we need to tackle this as a public health issue, the same way we tackle diabetes, obesity, et cetera, that there are some social determinants of health that not only predict global health outcomes, but I think are predictive of gun violence. And Lloyd mentioned some of them: poverty, unemployment, et cetera. There are certainly some things that we can do within these communities to help. I mean, being an anchor institution, trying to hire people, trying to create economic development opportunities, trying to purchase supplies from businesses in these communities, all can help raise all boats in those communities and hopefully stem gun violence. And certainly we can do public education in the communities about gun safety as well. There are too many healthcare organizations that are skittish about tackling this issue, fearful that they're going to come up against sort of the third rail of the Second Amendment. But I don't see how we can't tackle this issue, which is killing over 60,000 Americans per year.
Absolutely. Thomas, I'll turn it over to you because, you know, the University of Chicago has done some incredible work around this issue.
Yeah, we sure have. You know, and I think the key strategic decision we made was to build our own in-house violence prevention team and then really integrate into our care delivery and coordination processes. You know, our team consists of violence recovery specialists, and their job is really to connect victims of gun violence to the services that we offer. There's social workers, and there's chaplains, and there's child life specialists. You know, and we focus on multiple things. We focus on, you know, the spiritual side and make sure people's spiritual needs are met. Obviously, the medical care piece is critical in behavioral health services, and to make sure that the impact of violence is different. And we want to make sure that we have the right right behavioral health services for folks to recover. And then we also have to have support for the chronic health conditions as well as substance abuse for the victims or the family members of violence. The other part of this, and I think it goes back to both what Lloyd and Peter said, is you have to have a really close partnership with a community-based organization. You just can't do this alone as a healthcare organization. And our teams are integrated so that if there is a situation where someone comes to the University of Chicago as a victim of violence, and we believe that there may be retaliation because it's gang-related, we immediately connect with our community organizations to try to at least prevent or do our best to prevent any kind of retaliation. And they've had a lot of success with it. But I think it's a real combination of what you can do as a healthcare organization, but working very closely with the community.
I think that's spot on.
And if I could just add,
yeah, go ahead.
Go ahead. If I could just add one other point, something that I think the three of us really understand, and that is that we have to do more than just the treatment. Of course, when someone presents to our facility, our hospital, our access point, we're going to do everything that we can to save their life and to treat them in a way that they're needed. But our reach has to go beyond that, because the statistics show that if one survives a gunshot and goes right back into the community without some additional intervention, the probability that they may be back at our facility is higher than I think most people realize. So we can't just be in the community, we must be of the community. And as my colleagues have said, to integrate the treatment process, but it goes beyond our walls.
Yeah, no, I was just saying, I think, all these comments are just spot on. And, here at Northwell, I think we have the same approach, right? We can't combat gun violence without engaging the community or developing a robust hospital-based violence intervention program, which, all your hospitals and health systems have done a great job of doing. So with that, I'm just going to switch angles a little bit here. And I want to ask, why do you each feel that gun violence really is a public health issue within the healthcare sector? And what are some initiatives that your hospitals or health systems have done to combat this? And this time we'll start with Tom.
Yeah, no, absolutely. I mean, if you look at the difference in life expectancy for African-American communities versus other communities, it's about 8-year difference. About 25% of that is due to gun violence. So it's very clearly a public health issue. Now, I talked a lot about our initiatives, and I want to sort of go back to the fact that as the University of Chicago on the South Side, we are the, if you will, the biggest organization here. And I think we have an obligation to work really closely with our community and use our resources. I think Lloyd's point's exactly right. We can't just be reactive organizations and just wait for somebody to show up in our emergency room or our trauma center. We've got to get out there and work very closely in the community to make a difference. It's going to take a team effort. We are the only hospital in Chicago at the mayor's table talking about gun violence. We've got to be a very proactive participant and really work within the community. I think it's our obligation, and it's one where I think we can really make a difference.
And Tom, can you just elaborate just one point? I know that had come up in a conversation we had before. You stressed the importance of healthcare workers who also live in the communities that they serve. And you mentioned something about that at the University of Chicago. Can you elaborate on that?
Yeah, well, there's two. So number one, going back to the economic opportunities, we very closely, and I personally watch how we're recruiting locally to make sure that we're providing economic opportunity at the University of Chicago for people who are here on the South Side. But it's also really important to have people that know the community, that have the relationships, and live there. So we have our employees, but we also have our violence prevention workers who are really well integrated into the community and have the right life experiences so that they can help us identify problems, and hopefully we can get ahead of them before they turn into a violent act.
Wonderful. Lloyd, if you can take that same question.
Yeah, I would just add to what has been said is that, as we see the results of gun violence, and as we are treating individuals that unfortunately are suffering from gun violence, one of the things that we try to do, as I mentioned earlier, is to engage with law enforcement, to engage with social service organizations. And while we have that individual within our care, to try to look at opportunities where we just don't discharge them back into the exact same situation. And we try to the best of our ability, engage with the individual, their family, or whoever brought them to the facility. We also are using our voice on an advocacy basis at the state level and the national level to help folks understand the intersection between what we refer to as the social determinants of health and violence. One of the things that we see and have taken a step on is violence as it relates to human trafficking. And we've tried to provide education not only for our own staff, but to make sure that in most likely it's often women, that they're not going to just go back into the situation that they came down. And so education, we provide financial support. We try to provide grants, but we engage with churches. We engage with those organizations, again, that are integral to the community, the pastors, the ministers, the priests that have what we refer to as street credibility to help bring about change. We even engage directly with those who are leading opposition gang wars to try to bestow upon them the importance of diagnostically changing what is driving this violence. And obviously, the availability of guns is an issue, particularly with youth and in a lot of communities, but particularly vulnerable communities.
Thank you. Peter.
So we got into this in a major way a few years ago. Struck by the tens of thousands of people dying in this country every year as a result of gun violence, which unfortunately has gotten worse in the course of this pandemic. Thanks to the leadership and vision of two of our staff physicians, Connor Sachs, a physician on our medical service who unfortunately had a nephew who died at Sandy Hook, and Peter Masiakos, one of our pediatric trauma surgeons who's tired of caring for kids with who are victims of gun violence, we decided to establish a Center for Gun Violence Prevention at Mass General. And that center has a big educational component, both for our staff as well as for our patients. We've educated already over 150 of our residents in simulation programs so that they learn to become more comfortable talking to patients about issues related to gun violence. We've educated our patients about gun locks and gun safety locks, and in fact distribute gun safety locks in all of our primary care practices. We're also trying to teach people about the use of tourniquets in case they're unfortunate enough to be on the scene of somebody who is the victim of gun violence. And we are also just about to embark on a research effort in this area, funded by the hospital, but also funded by some philanthropy that we've received. If you look, unfortunately, the funding for research in this area is very limited, but it makes a huge difference. I mean, just the fact that we understand what a high proportion of gun deaths are due to suicide is very helpful in informing policies. And the fact through previous research that we know that if somebody tries to commit suicide with a gun, they're much, much more likely to be successful than if they were to use pills or other means. So research can make a big difference in shining a light on a path ahead that reduces the public health impact that guns have within our society.
Spot on. So, you're all doing such great work. How do we bring healthcare systems and hospitals together to have one unified voice on this issue? And I say that because, I want to talk about some of those challenges. I think, we heard from corporate folks earlier, some of the same issues plague the healthcare industry, right? A lot of hospitals and health systems, you already touched on this, Peter, a little bit, are very reluctant to get involved in this issue, even though we emphasize that this is a public health issue, a firearm safety issue, and not about the Second Amendment whatsoever. So how can we really mobilize as one voice and overcome that? Because we really haven't been able to. There's a lot of momentum, but we haven't been able to for decades. So Lloyd, if you can comment on that first.
Yeah, and I think you've called out one of the frustrations that I have, because as a sector, we see this violence and we see the tragedies of it. But I think there are things that we can do, and I am hopeful that by having discussions like this, that people will think about the following. Number one is that it's not just about the victim, but we all become victims. We have 150,000 members of our ministry or CommonSpirit Health that are in a variety of communities. So it's about their safety, the safety of their families. A community cannot have strength if its workforce has to dodge bullets in order to get to their place of residence. So I think that we have an opportunity as the healthcare sector, because we serve the majority of the communities in the aggregate, the sector in this nation, to call this question to the forefront. Because if you're not safe, I'm not safe. If you're worrying about guns, it is a destabilizer for the community. And the last thing that I would say is that we have got to, and I think the healthcare sector is well positioned to do this, realize that we've got to get into this conversation with our youth in this country at schools early on. We know the statistic that if a young child or a school-age child is in an environment where they have seen their friend has been shot, the probability of them beginning to numb themselves to the devastation of gun violence is something that we have to attack.
Absolutely. And I'll just briefly turn it over to Peter.
I would just say quickly that I applaud Northwell for pulling together this conference. Conversations like this can help raise awareness about this topic more broadly and help us achieve some alignment. And I would also say that we need to get our associations that we're part of focused on this issue as well. State associations and national associations like the American Hospital Association or the Association of American Medical Colleges. This needs to be on their agenda, and they need to help promote us sharing best practices among ourselves and also advocating at the state and federal level.
Definitely. Tom, if you want to just make a very brief comment.
I don't think there's anything that I can add that Lloyd and Peter just didn't nail. So, but I do say thank you for Northwell for bringing this together, because I think these kind of conversations are critical.
Thank you, everyone, for making the time.